She gave birth to a baby on March 17, 1880, in a farmhouse outside Asheville, North Carolina. The labor lasted 14 hours, and when the infant finally emerged, the midwife attending the birth screamed and dropped the child, backing away from the bed in horror. The baby was dead. But it hadn't just died during birth. It had been dead for years. The infant's body was partially mummified, its skin gray and leathery, its features preserved but shrunken, its tiny fingers curled into permanent fists. Medical examination would later confirm that this baby had died approximately 3 years earlier while still in its mother's womb, and had somehow remained there, calcified and preserved, while the mother continued to live, to move, to appear pregnant, until finally her body expelled what had become not a fetus, but a lithopedion, a stone baby, one of the rarest and most disturbing medical phenomena ever documented. The mother's name was Caroline Webb, and she was 24 years old when she gave birth to the child that had died inside her when she was 21. For 3 years, Caroline had carried the dead baby, feeling it as a weight in her abdomen, watching her stomach remain swollen in what appeared to be an endless pregnancy, experiencing occasional pains that physicians had dismissed as normal discomfort, never knowing that the child she had conceived was not developing, but was slowly turning to stone inside her body, calcifying in a biological process so rare that most physicians went their entire careers without seeing a single case. The dead infant weighed 4 pounds and measured approximately 14 inches long, the size of a baby born at around 6 or 7 months of gestation, which matched Caroline's last menstrual period 3 years earlier. The baby's sex was male, though the mummification had made this difficult to determine initially. The body was encased in a calcified membrane that had formed around it after death, the mother's body essentially encasing the dead fetus in calcium deposits as a defensive response to what it recognized as foreign tissue that needed to be isolated. This calcification had prevented the normal decomposition that would occur if a fetus died in utero, instead preserving the body in a grotesque parody of development, a dead child that remained visible and tangible rather than dissolving away. Henry Morrison, the physician who examined Caroline after the birth and who documented the case in detail in medical journals, wrote that he had never seen or heard of anything comparable in his 30 years of medical practice, that the very idea that a dead fetus could remain in a woman's body for 3 years seemed impossible according to everything he understood about human biology, and that examining the stone baby and the mother who had carried it forced him to confront how little medical science really understood about the mysteries of pregnancy, death, and the body's responses to catastrophic biological failures. Before we continue with the horrifying medical mystery of Caroline Webb and the baby that died inside her but remained for 3 years, transforming into stone while she carried on with her life, unaware that she was pregnant with death, subscribe to Shadows of America and hit that notification bell. We release hour-long investigations every day at 9 a.m. and 6 p.m. EST. Let us know in the comments what state you're watching from, because what happened to Caroline Webb represents one of the most disturbing medical conditions ever documented, and the 3 years she spent carrying a dead baby without knowing it will challenge everything you think you understand about pregnancy and death. Asheville, North Carolina in 1880 was a small mountain town with a population of approximately 2,600 people, located in the Blue Ridge Mountains and serving primarily as a center for agriculture and timber harvesting. The town had limited medical facilities, with just 2 physicians serving the entire area and most people relying on midwives for childbirth and on folk remedies for treating illnesses. Access to advanced medical care required traveling to larger cities like Charlotte or even further to medical centers in Virginia or South Carolina, and for poor families like Caroline Webb's, such travel was often impossible due to cost and logistics. Caroline Webb had been born in 1856 to a farming family in the mountains outside Asheville. She was the third of 7 children, and her upbringing was typical for poor rural families in the post-Civil War South. Limited education, early introduction to farm work, an expectation that she would marry young and begin her own family. Caroline married Thomas Webb in 1876 when she was 20 years old, and the couple established a small farm on land they rented from a larger landowner, growing corn and vegetables for their own consumption and raising chickens and pigs to sell for cash income. Caroline's first pregnancy occurred in 1877, approximately a year after her marriage, and resulted in the birth of a healthy daughter named Elizabeth in early 1878. The pregnancy and delivery were normal according to the midwife who attended, and Caroline recovered without complications. She resumed her farm work within weeks of giving birth, as economic necessity required that she contribute to household labor, regardless of her physical condition. Caroline became pregnant again in the summer of 1877, conceiving her second child while still nursing her first. This second pregnancy seemed normal initially. Caroline experienced the expected missed menstrual periods, morning nausea, breast tenderness, and gradual abdominal swelling that indicated fetal development. But around what she calculated to be 6 months into the pregnancy, in approximately January 1878, Caroline stopped feeling fetal movement. She had been feeling regular kicks and movements for several weeks, and their sudden cessation was noticeable and concerning to her. Caroline mentioned the cessation of fetal movement to the midwife who lived in her area, a woman named Martha Henderson, who had delivered dozens of babies and who was the primary source of pregnancy care for women in the mountain communities around Asheville. Henderson examined Caroline by palpating her abdomen and listening for fetal heartbeat by placing her ear against Caroline's belly, which was the standard method for assessing fetal health before the development of more sophisticated monitoring technology. Henderson reported that she couldn't hear a heartbeat, but told Caroline that this wasn't necessarily concerning, that sometimes babies were positioned in ways that made heartbeats difficult to detect, and that the absence of movement might just mean the baby was sleeping or was a naturally calm fetus rather than an active one. Henderson advised Caroline to wait and see if movement resumed, to continue eating well and resting when possible, and to notify her if any concerning symptoms developed such as fever, severe pain, or vaginal bleeding. But Henderson did not recognize, possibly because she had never encountered or heard of such a condition, that the cessation of fetal movement likely indicated that the fetus had died, and that Caroline was now carrying a dead baby that her body had not recognized as dead or had not been able to expel. Over the following weeks and months, Caroline continued to appear pregnant. Her abdomen remained swollen, though it did not continue to grow at the rate that would be expected if the fetus were developing normally. She experienced occasional abdominal pains that she interpreted as the baby shifting position or as practice contractions preparing her body for labor. She waited for labor to begin, expecting that she would give birth around July 1878, approximately 9 months from conception. But July came and went without any signs of labor, and Caroline began to worry that something was wrong with her pregnancy. She consulted with Martha Henderson again, who examined her and expressed confusion about why labor hadn't begun. Henderson suggested that Caroline might have miscalculated her conception date, that perhaps she had become pregnant later than she thought, and therefore wasn't yet full term. Henderson advised continued waiting, suggesting that labor would begin when the baby was ready. But August passed, then September, then October, with Caroline remaining pregnant beyond any normal gestation period and still experiencing no labor contractions or other signs that delivery was imminent. By late 1878, Caroline's condition was causing concern and puzzlement among the women in her community who were aware of her prolonged pregnancy. Some suggested that she was experiencing what they called a sleeping baby, a folk belief that some babies could remain dormant in the womb for extended periods, essentially hibernating before being born. Others suggested that Caroline had experienced a false pregnancy, that she wasn't really pregnant at all, but was experiencing psychological and physical symptoms that mimicked pregnancy. Still others whispered that something unnatural was occurring, that Caroline's extended pregnancy was evidence of witchcraft or divine punishment for unspecified sins. Thomas Webb, Caroline's husband, became increasingly concerned about his wife's health and about the strange pregnancy that showed no signs of ending. He consulted with one of Asheville's 2 physicians, Dr. Henry Morrison, explaining Caroline's situation and asking for medical advice. Morrison agreed to examine Caroline, making the long trip to the Webb farm in December 1878 to assess her condition. Morrison's examination confirmed that Caroline's abdomen was distended and firm, consistent with pregnancy, but he found several concerning features. He could not detect fetal movement through palpation, could not hear a fetal heartbeat, even with careful listening, and found that Caroline's abdomen did not have the normal shape and consistency of a pregnancy at what should have been over a year past conception. Morrison suspected that something had gone wrong with the pregnancy, but without X-rays or ultrasound or other diagnostic tools beyond physical examination, he couldn't determine what exactly was occurring inside Caroline's body. Morrison told Caroline and Thomas that the baby had likely died months earlier, and that Caroline's body had failed to recognize the death and expel the fetus naturally, a condition called missed abortion or missed miscarriage in modern medical terminology. He explained that sometimes when a fetus dies in utero, the body doesn't immediately recognize the death, and the pregnancy continues in a kind of biological confusion where the hormonal signals and physical changes of pregnancy persist, even though fetal development has stopped. Morrison recommended that Caroline be transported to a hospital in Charlotte, where physicians might be able to induce labor or perform surgery to remove the dead fetus. But traveling to Charlotte was a multi-day journey that would cost money the Webb family didn't have, and Caroline was reluctant to leave her young daughter and her farm responsibilities for what might be weeks of hospitalization. She decided to wait, hoping that her body would eventually expel the dead baby naturally without requiring intervention that was both expensive and frightening, given the risks of surgery in the 1870s. Morrison reluctantly accepted this decision, but warned Caroline that carrying a dead fetus for extended periods could lead to infection or other complications that might threaten her life, and he urged her to seek help immediately if she developed fever, severe pain, or any signs of serious illness. Throughout 1879, Caroline continued to live with what she now understood was a dead baby inside her body. The psychological burden of this knowledge was immense. She was aware, every moment of every day, that she was carrying death, that her abdomen contained not a developing child but a corpse, that her body had become a tomb for the baby she had conceived, but who would never be born alive. She experienced depression and anxiety, struggled to sleep, found herself avoiding interactions with neighbors who would ask about her pregnancy, and when the baby would be born, forcing her to explain repeatedly that something had gone wrong, and that she was waiting for the baby to emerge even though it was already dead. The physical burden was also significant. The mass in Caroline's abdomen caused chronic discomfort and occasional pain. It restricted her movement and made farm work more difficult. It affected her ability to care for her young daughter Elizabeth, who was now old enough to ask questions about her mother's big belly and about when the baby brother or sister would arrive, questions that Caroline found heartbreaking to answer because she had to explain to a small child that the baby was dead but was still inside mommy's body waiting to come out. Caroline's menstrual periods had not resumed, which was not surprising given that her body apparently still believed it was pregnant even though the fetus had been dead for over a year. She experienced some pregnancy symptoms including nausea and fatigue, though whether these were physical responses to her condition or psychological reactions to the stress of her situation was unclear. She avoided consulting physicians or midwives, partly because of cost, and partly because previous consultations had provided no solutions except expensive interventions she couldn't afford. But in early 1880, Caroline began experiencing new symptoms that frightened her enough to overcome her reluctance to seek medical help. She developed severe abdominal pain that came in waves, similar to labor contractions. She also experienced vaginal discharge that was discolored and foul-smelling, suggesting possible infection. These symptoms prompted Thomas Webb to bring Dr. Morrison back to the farm in February 1880 to examine Caroline and assess whether immediate intervention was necessary despite the costs and risks involved. Morrison's examination revealed that Caroline's condition had changed. Her cervix, which had remained closed for the past 2 years despite the dead fetus in her uterus, had begun to dilate slightly, suggesting that her body was finally beginning the process of expelling the long-dead baby. The infection that Morrison suspected based on the discharge was concerning, but did not appear to be life-threatening at the moment. Morrison advised that labor might be beginning naturally, that Caroline's body was finally recognizing that it needed to expel the dead fetus, and that the process might complete itself without requiring surgical intervention. Morrison told Caroline to call for Martha Henderson, the midwife, when labor contractions became stronger and more regular, and he gave instructions about monitoring for signs of severe infection or hemorrhage that would require immediate medical intervention, regardless of cost. He also warned Caroline that the delivery of a long-dead fetus might be traumatic and disturbing, that the baby would not look like a normal infant, and that she should prepare herself emotionally for what she might see. On March 16, 1880, Caroline's labor contractions intensified to the point where Thomas sent for Martha Henderson. Henderson arrived at the Webb farm that evening and settled in to assist with what everyone expected would be a sad and disturbing, but ultimately straightforward delivery of a dead baby. But as the labor progressed through the night and into the next day, Henderson became increasingly alarmed by what she was observing. Caroline's labor was prolonged and extremely painful, lasting 14 hours despite the fact that the fetus should have been small enough to deliver relatively easily. Henderson could feel that the mass being expelled was hard and irregular in shape, not soft and flexible like a normal fetus would be. When the mass finally emerged in the early afternoon of March 17th, Henderson initially didn't recognize it as a baby at all. It looked like a strange stone object, grayish and calcified, shaped vaguely like an infant but having the texture and weight of mineral deposits rather than human tissue. Henderson screamed and dropped the object when she realized it was supposed to be a baby, so disturbed by its appearance that her professional composure completely failed. Thomas Webb, who had been waiting outside the room during the delivery, rushed in when he heard the scream and found Henderson backing away from what had just been born, staring at it in horror. Caroline, exhausted from 14 hours of labor and disoriented from pain and blood loss, couldn't see what had been delivered and kept asking Henderson to show her the baby, to let her hold it, not understanding why the midwife was reacting with such extreme distress. When Caroline finally saw what had emerged from her body, she fainted. Thomas later described his wife's reaction as one of complete psychological collapse, as if seeing the stone baby had broken something fundamental in her mind, as if she couldn't process what she was looking at because it violated everything she understood about babies and birth and what her body should have been carrying for the past 3 years. Caroline remained unconscious for several minutes, and when she regained consciousness, she became hysterical, screaming and crying and insisting that the stone object couldn't be what had been inside her, that it must be something else, that her real baby must still be inside her waiting to be born. Martha Henderson, recovering some of her professional composure, wrapped the stone baby in cloth and set it aside, then focused on caring for Caroline, who was hemorrhaging more heavily than normal after the delivery and who was showing signs of infection including fever and confusion. Henderson sent Thomas to fetch Dr. Morrison immediately, recognizing that Caroline's condition was deteriorating and that medical intervention beyond a midwife's skills was urgently needed. Dr. Morrison arrived several hours later and immediately assessed that Caroline was in serious danger from postpartum hemorrhage and infection. He administered medications to reduce bleeding and fever, manually checked that Caroline's uterus was contracting properly and that no tissue remained inside that could cause continuing hemorrhage or infection, and provided supportive care while waiting to see if Caroline would stabilize or continue to deteriorate. While providing this care, Morrison examined the object that had been delivered, initially assuming it was just a malformed stillbirth, but quickly realizing it was something far stranger and more medically significant. The baby's body was partially mummified and partially calcified, with soft tissues that had dried and shrunken, while skeletal structures and some organs had become encrusted with calcium deposits. The skin was leathery and gray, the features recognizable as human but shrunken and distorted. The body was rigid rather than flexible, and when Morrison attempted to position the limbs, they resisted movement as if they were made of stone rather than bone and tissue. The weight was much greater than a normal infant of this size would have been, consistent with significant calcium deposition throughout the body. Morrison immediately recognized that what he was examining was a lithopedion, a medical phenomenon he had read about in textbooks but had never expected to encounter in his rural practice. Lithopedion, from Greek words meaning stone child, occurs when a fetus dies during pregnancy, usually in an ectopic pregnancy outside the uterus, and the mother's body is unable to expel it or absorb it. As a protective mechanism, the body begins depositing calcium around the dead fetus, essentially encasing it in stone to isolate it from surrounding tissues and prevent infection from the decaying body. But most reported cases of lithopedion involved ectopic pregnancies in the abdominal cavity, where a fertilized egg had implanted outside the uterus and had developed there until the abnormal implantation site could no longer support fetal growth. Caroline's case appeared to be different. The pregnancy had been in the uterus, had developed normally for months, and only then had the fetus died and undergone calcification while still in the womb. This was even more rare than typical lithopedion, and Morrison recognized that documenting this case carefully would be important for medical science. Over the following days, Morrison focused primarily on Caroline's physical recovery, while also studying the stone baby in detail. Caroline survived the hemorrhage and infection, though her recovery was complicated and prolonged, but her psychological recovery was far more difficult and would never be complete. The trauma of having carried a dead baby for 3 years, of having given birth to something that looked like a stone sculpture rather than a child, of having her body produce such a grotesque outcome from what should have been the normal, natural process of pregnancy and childbirth, damaged Caroline's mental health in ways that no medical treatment of the 1880s could address. Caroline experienced what we would now recognize as severe post-traumatic stress disorder. obsessing about the stone baby, having nightmares about it, unable to stop thinking about what had happened inside her body for 3 years. She developed a phobia of pregnancy, refusing all physical intimacy with her husband, out of terror that she might become pregnant again and might experience another lithopedion. She became withdrawn and depressed, struggling to care for her daughter Elizabeth, unable to resume normal farm work or social relationships. Thomas Webb tried to support his wife, but he was also traumatized by what had occurred and had no resources or knowledge for helping someone with severe psychological trauma. The marriage deteriorated under the strain, with Caroline and Thomas increasingly unable to connect with each other or to discuss what had happened without triggering Caroline's anxiety and distress. They remained married, but essentially living separate emotional lives, united by their shared trauma, but unable to help each other heal from it. Dr. Morrison, meanwhile, became fascinated with the medical aspects of Caroline's case and devoted significant time to studying the stone baby and documenting everything about Caroline's pregnancy history, her delivery, and the characteristics of the calcified fetus. He measured and weighed the stone baby, attempted to determine its gestational age at death based on its size and developmental features, examined the calcification patterns, and compared what he found to the limited medical literature about lithopedion that existed in 18. Morrison contacted physicians at medical schools in Virginia and North Carolina, describing Caroline's case and asking for their expertise in understanding what had occurred. He eventually sent the stone baby itself to the medical school at the University of North Carolina, where pathologists could examine it using techniques and resources not available in rural Asheville. The stone baby became a teaching specimen, displayed in medical school collections and used to educate future physicians about rare medical phenomena. The pathological examination of the stone baby confirmed Morrison's initial assessments and provided additional details. The fetus appeared to have been approximately 6 to 7 months gestational age when it died, consistent with Caroline's recollection that fetal movement had stopped around that time in her pregnancy. The cause of death could not be determined from examining the calcified remains. Any soft tissue evidence that might have indicated why the fetus died had been destroyed by the mummification and calcification process, but the examination confirmed that this had been a normal pregnancy with a normally developing fetus that had died for unknown reasons and had then undergone the extremely rare process of lithopedion formation. The medical school pathologists also examined tissue samples from Caroline's uterus and from the membrane that had surrounded the stone baby, trying to understand the biological mechanisms that had allowed the dead fetus to remain in her body for 3 years without causing life-threatening infection or being expelled naturally. They found evidence that Caroline's body had created a thick fibrous capsule around the dead fetus, essentially walling it off from surrounding tissues and preventing the decomposition and infection that would normally occur when tissue dies inside the body. The calcification had occurred gradually over months and years, with calcium salts from Caroline's blood being deposited in layers around the dead fetus, turning it from flesh into stone. This process of calcification had apparently created a biological stalemate. The dead fetus was isolated enough that it didn't cause immediate infection or trigger the hormonal changes that would normally signal the body to expel it, but it wasn't absorbed or broken down either, instead just remaining as an inert mass that Caroline's body treated as foreign material that needed to be contained but couldn't be eliminated. This stalemate persisted for 3 years until finally, in 1880, something changed. Perhaps the capsule weakened. Perhaps infection began to develop despite the isolation. Perhaps Caroline's body finally recognized that this mass needed to be expelled, and labor began, eventually delivering the calcified remains. Morrison published detailed case reports about Caroline Webb and her stone baby in several medical journals in 1880 and 1881, making Caroline's case one of the most thoroughly documented examples of lithopedion in 19th-century medical literature. Morrison's reports were read by physicians throughout the United States and Europe, and Caroline's case became cited in medical textbooks as an example of this rare phenomenon, and as evidence of the bizarre and disturbing things that could occur when normal biological processes failed in unusual ways. But while Caroline's case contributed to medical knowledge, the fame and attention it generated brought no benefit to Caroline herself and arguably caused her additional harm. News of the stone baby spread throughout North Carolina and beyond, with newspaper articles describing the case in sensational terms that emphasized its bizarre and grotesque aspects. People traveled to Asheville, hoping to see the stone baby before it was sent to the medical school, and some even came to the Webb farm seeking to see Caroline herself, to talk to the woman who had carried death inside her for 3 years, treating her as a curiosity rather than as a suffering human being. Caroline became reclusive, refusing to speak with journalists or curious visitors, attempting to hide from the attention that her medical condition had generated. She felt violated by the public interest in her body, and her experience felt that her suffering had been turned into entertainment for people who had no understanding of what she had endured and no empathy for her trauma. She resented Dr. Morrison for publishing her case, even though he had not used her full name in the medical journals and had attempted to protect her privacy to the extent possible while still documenting medically significant information. The psychological burden of being known as the Stone Baby Woman added to Caroline's existing trauma and made her recovery even more difficult. She couldn't go into Asheville without people staring at her, whispering to each other, treating her as an object of morbid fascination. She felt that her identity had been reduced to her medical abnormality, that people saw her not as a person, but as the woman who had the bizarre and disturbing pregnancy, that her whole life had been overshadowed by those 3 years of carrying a dead baby that turned to stone. By 1882, about 2 years after the delivery of the stone baby, Caroline's mental health had deteriorated to the point where she was unable to function in daily life. She experienced constant anxiety and depression, had difficulty sleeping, couldn't concentrate on tasks, and sometimes experienced episodes where she seemed to lose awareness of her surroundings and would stand motionless for minutes at a time, apparently lost in traumatic memories. Her husband Thomas, overwhelmed by trying to manage the farm and care for their daughter, while also attempting to support his increasingly ill wife, sought help from Dr. Morrison about whether anything could be done to improve Caroline's condition. Morrison recognized that Caroline was experiencing what he called nervous disorder or melancholia, terms used in the 1880s for what we would now recognize as severe post-traumatic stress disorder and depression. Treatment options were extremely limited. Psychiatry barely existed as a medical specialty, and effective medications for depression and anxiety would not be developed for many more decades. The main treatments available were rest, removal from stressful situations, and sometimes institutionalization in asylums for people whose mental illness was so severe they couldn't function, or who posed danger to themselves or others. Morrison recommended that Caroline be sent to a rest home or spa, where she could be away from the farm and away from the community where everyone knew about her stone baby, where she could potentially recover in a peaceful environment without the constant reminders of trauma that surrounded her in Asheville. But such facilities were expensive and were located in distant cities, and the Webb family had neither the money for treatment nor the ability to manage the farm and care for Elizabeth if Caroline were sent away for an extended period. Unable to access professional mental health care, Caroline remained at home, struggling through each day, gradually withdrawing further into herself. She stopped speaking except when absolutely necessary, stopped engaging with her daughter, stopped participating in any social or community activities. She existed rather than lived, trapped in psychological patterns created by trauma and having no resources or support that could help her escape those patterns. In 1885, 5 years after delivering the stone baby, Caroline Webb died at age 29. The official cause of death was recorded as consumption, tuberculosis, but Dr. Morrison noted in Caroline's medical file that he believed her death was as much psychological as physical, that she had essentially given up on life, that her will to survive had been destroyed by the trauma she experienced and by her inability to recover from it. Morrison wrote that Caroline's death represented a medical failure, not just in terms of the rare lithopedion that had occurred, but in terms of the lack of effective treatments for the psychological damage that medical crises could cause. Caroline was buried in a small cemetery near her farm, her grave marked with a simple headstone that gave her name and dates, with no reference to the stone baby or to the medical phenomenon that had defined the last years of her life. Her daughter Elizabeth, who was 7 years old when Caroline died, was raised by relatives and grew up having only vague memories of a mother who had been sad and distant, not understanding until she was much older what had happened to Caroline and why her mother had been so psychologically damaged. The stone baby itself remained in the medical collection at the University of North Carolina for many years, displayed in a glass case as a teaching specimen for medical students learning about rare obstetrical phenomena. The specimen was labeled with Caroline's initials and the year of the case, but most people who saw it had no knowledge of Caroline as a person, saw only the bizarre calcified object rather than understanding the human suffering that had produced it and that had resulted from it. Medical understanding of lithopedion advanced slowly over the following decades, with additional cases being documented and studied to understand the biological mechanisms that caused this rare phenomenon. By the early 20th century, physicians understood that lithopedion occurred most commonly in ectopic pregnancies, where the fetus developed outside the uterus, typically in the abdominal cavity, and died when the abnormal implantation site could no longer support fetal growth. The mother's body, unable to expel the dead fetus and unable to break it down and absorb it, would begin calcifying it as a protective mechanism to prevent infection from the decaying tissue. But cases like Caroline's, where lithopedion occurred following a normal intrauterine pregnancy, remained extremely rare and poorly understood. Most intrauterine fetal deaths resulted in spontaneous miscarriage, with the mother's body recognizing the fetal death and expelling the dead tissue within days or weeks. Caroline's case, where a dead fetus remained in the uterus for 3 years while undergoing calcification, represented such an unusual biological response that physicians struggled to explain why it had occurred or to predict when similar cases might occur in the future. Modern medical understanding has provided some insights into why lithopedion occurs, though many mysteries remain. The calcification process appears to be triggered when a dead fetus remains in the body for extended periods without being expelled or absorbed, and when the body's immune system successfully prevents infection despite the presence of dead tissue. Calcium salts from the mother's blood gradually infiltrate the fetal tissues, depositing in layers over months or years, eventually transforming soft tissues into calcified masses that have stone-like properties. But why some women's bodies successfully prevent infection and allow calcification to occur while most women with retained dead fetuses develop serious infections that require medical intervention remains unclear. There appear to be individual biological variations in immune response, in how the body walls off dead tissue, and in how long the body can maintain the isolation that prevents infection. Caroline Webb must have had biological characteristics that allowed her body to maintain this isolation for 3 years, creating the stalemate that resulted in the stone baby rather than an infection and death that would have been more likely outcomes. The psychological impact of carrying a dead fetus for extended periods, even when the woman knows the fetus is dead, has been studied more extensively in modern times and is now recognized as profoundly traumatic. Women who experience fetal death and who have to wait even days or weeks for labor to begin naturally or for surgical intervention to be scheduled report intense psychological distress, describing the experience as carrying death inside them, as having their body turned into a tomb, as being trapped in a horrible liminal state between pregnancy and not pregnancy. Caroline's experience of carrying the dead baby for 3 years, much of that time not even knowing it was dead, and then giving birth to something that looked like stone rather than a baby, represented trauma of an intensity that 19th century medicine had no ability to treat, and that even modern psychiatry would find challenging to address. The stone baby that was delivered from Caroline's body remained in the University of North Carolina medical collection until the 1960s, when changing attitudes about medical ethics and human remains led to discussions about whether displaying specimens like this was appropriate. Some argued that the stone baby was an important teaching tool that helped medical students understand rare phenomena and that removing it from the collection would represent a loss to medical education. Others argued that the specimen represented human remains that deserved respectful treatment, including burial, and that displaying it in a glass case was disrespectful to both the dead baby and to Caroline Webb, who had suffered enough during her life without having the product of her suffering put on permanent display. The debate about the stone baby and similar medical specimens reflected broader changes in how medicine understood the relationship between advancing scientific knowledge and respecting human dignity and privacy. In the 19th century, physicians like Dr. Morrison saw no conflict between documenting unusual cases publicly and preserving specimens for teaching purposes. They viewed this as serving the greater good of medical knowledge and education, and they assumed that individual patients would understand and accept their role in advancing science, even if it meant losing privacy or having their bodies or body parts put on display. But by the late 20th century, medical ethics had evolved to place much greater emphasis on patient autonomy, privacy, and dignity. The idea that physicians could publish detailed case reports or preserve body parts for display without explicit informed consent from patients or their families was recognized as ethically problematic. Many medical museums removed human remains from display and either buried them respectfully or stored them in restricted access areas where they could be studied by researchers but were not publicly exhibited. The specific fate of Caroline Webb's stone baby is unclear from available historical records. Some sources suggest it was eventually buried in the cemetery where Caroline herself was buried, reuniting the dead baby with the mother who had carried it in life and in death. Other sources suggest it remained in the medical school collection, but was moved from public display to restricted storage. Still others suggest it may have been lost or destroyed during renovations or transitions in medical school facilities over the decades. Wherever the physical specimen ended up, the medical documentation of Caroline's case remained in medical literature and continued to be cited in obstetrics textbooks and medical journals throughout the 20th century. Caroline's case was used to teach medical students about lithopedion, about the rare complications that could occur when fetal death was not recognized or when the body failed to expel dead tissue naturally, and about the psychological consequences of traumatic pregnancy outcomes. Dr. Henry Morrison continued to practice medicine in Asheville until his death in 1902, and he maintained throughout his life that Caroline Webb's case was the most medically significant and most personally affecting case he had encountered in his career. Morrison's published papers about the case remain standard references on lithopedion for decades, and his careful documentation of Caroline's pregnancy history, the delivery of the stone baby, and Caroline's subsequent psychological decline provided valuable information that helped later physicians recognize and understand similar cases. But Morrison also expressed regret in his later writings about the personal cost that Caroline had paid for advancing medical knowledge. He acknowledged that the publicity surrounding her case had contributed to her psychological trauma, that being known as the stone baby woman had made it impossible for Caroline to recover from the initial trauma of the pregnancy itself. Morrison suggested that medical ethics needed to evolve to better protect patients' privacy and dignity, that the benefits of advancing medical knowledge needed to be balanced against the potential harm to individual patients whose cases were made public. Morrison's reflections were ahead of their time in recognizing the ethical complexities of medical case reporting, though they came too late to help Caroline herself. His later writings showed awareness that medicine needed to consider not just the physical outcomes of treatment, but also the psychological and social impacts on patients' lives, that publishing detailed case reports without considering how that publicity would affect patients was ethically problematic, even when done with good intentions of advancing medical science. Thomas Webb, Caroline's husband, remarried in 1887, 2 years after Caroline's death, to a woman named Sarah Mitchell, who helped raise Elizabeth, and who gave Thomas 3 more children over the following years. Thomas never spoke publicly about Caroline or about the stone baby, maintaining privacy about what his first wife had experienced and attempting to move forward with his life. Elizabeth Webb grew up knowing that something terrible had happened to her mother, but not understanding the details until she was an adult and could read the medical journal articles that Dr. Morrison had published about the case. Elizabeth later described feeling disturbed and violated by the detailed medical descriptions of her mother's body and pregnancy that were available in medical literature for anyone to read. Feeling that her mother's privacy and dignity had been sacrificed for medical education in ways that Caroline herself had never fully consented to or understood. Elizabeth became an advocate for patient privacy rights in the early 20th century, working with women's organizations to promote laws that would protect patients from having their medical information published without explicit consent. The small mountain community, where the Webb family had lived, gradually forgot about Caroline and the stone baby as decades passed, and as the people who had known Caroline personally died. The farm where Caroline had lived, and where she had given birth to the stone baby, was eventually sold and redeveloped, the original buildings demolished and replaced. The cemetery where Caroline was buried remains, and her gravestone is still visible, though it provides no indication to casual visitors of her medical condition or of the suffering she experienced. Modern medical understanding of lithopedion has advanced significantly since Caroline Webb's case in 1880, though the condition remains extremely rare and continues to surprise physicians when it is encountered. The development of ultrasound technology in the mid-20th century made it possible to detect fetal death much earlier in pregnancy and to identify cases where dead fetal tissue is being retained rather than expelled naturally. This early detection allows for medical intervention, either inducing labor or performing surgery to remove the dead tissue before calcification can occur, preventing the formation of stone babies in virtually all modern pregnancies. The few lithopedion cases that do occur in modern times are typically discovered incidentally during imaging studies performed for unrelated reasons, with women carrying calcified fetal remains for decades without knowing it until an X-ray or CT scan for back pain or abdominal symptoms reveals the presence of calcified tissue. These women often report having had a pregnancy decades earlier that seemed to end in miscarriage, but that apparently did not fully expel all fetal tissue, with the remaining tissue becoming calcified over time and remaining asymptomatic for years. Modern surgical techniques allow for removal of lithopedion when they are discovered, though if the calcified mass is not causing symptoms and is not at risk of causing complications, many physicians recommend leaving it in place rather than performing surgery to remove it. The calcified tissue is biologically inert, essentially just calcium deposits in the shape of a fetus, and does not pose health risks once the initial period where infection might have occurred has passed. Removing it requires major abdominal surgery that carries its own risks, and many women choose to live with the knowledge that they are carrying calcified fetal remains rather than undergoing surgery. The psychological impact of discovering that one is carrying a calcified baby, sometimes decades after the pregnancy occurred, is profound even when the discovery happens in modern times with access to psychological counseling and support that was not available to Caroline Webb. Women report feeling disturbed and traumatized by the knowledge that they have been carrying death inside their bodies for years without knowing it, that their bodies have been tombs for babies that never had a chance to live. Even though the women typically have had other successful pregnancies and healthy children, the knowledge about the stone baby affects how they view their bodies and their reproductive history. Some modern women who have discovered lithopedion and who have chosen to have them removed have requested that the remains be buried or cremated with appropriate funeral services, treating the stone baby as they would any child who had died, giving it a name and a grave, and acknowledging the loss even though the death occurred decades earlier. These rituals help some women find closure and peace about the pregnancy loss, though others report that no ritual can fully address the disturbing nature of having carried calcified remains for so long. The medical literature on lithopedion includes discussions not just of the biological mechanisms that create stone babies, but also of the psychological and ethical implications of this rare condition. Physicians who have treated patients with lithopedion emphasize the importance of sensitive communication about the diagnosis, recognizing that learning one is carrying a calcified baby is traumatic, regardless of how long ago the original pregnancy occurred. They stress the need for psychological support and counseling to help patients process the diagnosis and decide whether they want the remains removed or left in place. The ethical questions about what to do with lithopedion that are removed during surgery remain complex. Should they be treated as medical waste and disposed of through standard hospital procedures? Should they be treated as human remains and given respectful burial? Do patients have the right to keep the remains if they choose? Or do medical and public health regulations prohibit this? Different jurisdictions and different hospitals have different policies about these questions, and there is no universal consensus about the right approach. Caroline Webb's case, documented in detail in 1880s medical literature, continues to be cited in modern discussions of these ethical issues as an example of how medical documentation and specimen preservation can harm patients even when done with good intentions of advancing medical knowledge. Caroline's story reminds medical professionals that patients are not just cases or teaching opportunities, but are human beings whose privacy, dignity, and psychological well-being must be protected even when their medical conditions are scientifically interesting or rare. The stone baby phenomenon also raises broader philosophical questions about the nature of life and death, about when something stops being a person and becomes just tissue or calcified material, and about how we should understand and respond to biological processes that don't follow normal patterns. The fetus that died inside Caroline Webb was at one point a developing human being with potential for life, but after death and calcification, it became something else. Not quite human remains in the normal sense, not quite just mineral deposits, but something in between that challenges our categories and our understanding. Religious and spiritual perspectives on lithopedion vary widely. Some religious traditions would view the stone baby as human remains that deserve burial and mourning according to standard funeral practices, regardless of how long after death the remains emerge from the mother's body. Other traditions might view the calcified tissue as no longer human once the soul has departed, making it more like discarded body tissue than like a person who died. Still others might view lithopedion as evidence of mysterious divine purposes or as biological phenomena that defy easy moral categorization. Caroline Webb herself never publicly expressed her own understanding of the stone baby or whether she viewed it as the child she had lost or as something else. Her psychological trauma and her withdrawal into silence in the years after the delivery made it impossible for those around her to know how she made sense of what had happened. Whether she mourned the baby as a lost child or whether she tried to distance herself psychologically from the experience by viewing it as a bizarre medical phenomena rather than as a pregnancy loss. Her silence preserved her privacy but also left questions about her inner experience that can never be answered. The daughter Caroline did successfully give birth to, Elizabeth, carried her own psychological burden from her mother's condition, even though Elizabeth was too young at the time to understand what was happening. Growing up with a mother who was profoundly depressed and traumatized, who withdrew emotionally and who eventually died when Elizabeth was only 7, created lasting impacts on Elizabeth's own mental health and on how she viewed pregnancy and motherhood. Elizabeth reportedly feared pregnancy herself when she was old enough to marry, worried that she might experience something like what had happened to her mother, though she eventually had 3 healthy children without complications. The intergenerational trauma that resulted from Caroline's lithopedion. How it affected not just Caroline, but also her husband, her daughter, and even her grandchildren, who grew up hearing family stories about the tragic event, demonstrates how rare medical complications can have ripple effects that extend far beyond the individual patient. The stone baby became a defining event in the Webb family history, something that shaped multiple generations' understanding of pregnancy, of medicine, of what could go wrong with women's bodies in ways that 19th century medicine could not prevent or adequately treat. Modern genetic and medical research has attempted to identify whether there are risk factors that make lithopedion more likely to occur in some women than in others, but results have been inconclusive. The condition is too rare for large-scale studies, and the biological mechanisms are too complex and too poorly understood to identify clear genetic or physiological markers that would predict which women might experience this complication. It appears to be primarily a matter of tragic chance, a combination of fetal death at a particular gestational age, maternal biological responses that allow calcification rather than infection, and circumstances that prevent normal expulsion of the dead tissue. The development of modern prenatal care, including regular ultrasound monitoring and immediate medical attention for any signs that fetal development has stopped, has made lithopedion formation virtually impossible in developed countries with access to good medical care. But in regions with limited medical resources, where women may not receive regular prenatal care and where fetal death might go undetected for extended periods, lithopedion cases continue to occur occasionally, with women sometimes carrying calcified babies for decades before the remains are discovered. International medical organizations have used cases like Caroline Webb's to argue for the importance of expanding access to prenatal care globally, emphasizing that basic ultrasound monitoring and prompt attention to pregnancy complications can prevent not just lithopedion, but many other devastating outcomes that result from lack of medical care. Caroline's suffering and death at age 29, a direct result of carrying a dead baby for 3 years because she lacked access to medical intervention that could have removed it, represents the kind of preventable tragedy that continues to occur in resource-poor settings where women's health care is inadequate. The story of Caroline Webb and her stone baby has been retold in various popular media over the years, including in books about medical mysteries, in television programs about strange medical conditions, and in internet articles about bizarre historical events. These retellings often emphasize the shocking and grotesque aspects of the case. The idea of a dead baby turning to stone inside a living woman's body is inherently disturbing and captures public attention in ways that more common medical conditions do not. But these popular retellings often neglect the human dimension of Caroline's story, focusing on the medical oddity while giving little attention to Caroline's suffering, her psychological trauma, her inability to recover, and her premature death. They treat her case as entertainment, as a bizarre historical curiosity, in ways that echo the treatment Caroline herself received in the 1880s when newspapers sensationalized her story and curious people traveled to gawk at her. This pattern of reducing women who experience rare or unusual medical conditions to their medical oddities, of treating them as curiosities rather than as suffering human beings deserving of compassion and privacy, continues to affect how unusual medical cases are discussed in popular culture. Medical ethicists and women's health advocates have used Caroline's case and similar historical examples to argue for more respectful and humanized discussion of medical conditions, for approaches that recognize patients as whole people rather than as interesting cases, and for greater sensitivity to how public discussion of medical details can harm patients' dignity and psychological well-being. The goal is not to suppress medical education or to prevent physicians from learning about rare conditions, but rather to ensure that such education is done in ways that respect patients' humanity and that protect their privacy and dignity. Caroline Webb's grave in the small mountain cemetery near Asheville remains a quiet memorial to a woman whose life was defined and ultimately destroyed by a rare medical condition that she had no way to prevent and that 19th century medicine could not adequately treat. The simple headstone marks the burial place of a woman who experienced something that should never happen, who carried death inside her for 3 years, who gave birth to stone instead of life, and who never recovered from the trauma of that impossible experience. The stone baby that emerged from Caroline's body on March 17, 1880, wherever its physical remains ultimately ended up, represents not just a medical curiosity, but a testament to the fragility of pregnancy, the mysteries of human biology, and the ways that bodies can respond to catastrophic failures in unexpected and disturbing ways. It represents the limits of medical understanding and medical intervention in the 19th century, when physicians could document and study, but could not prevent or adequately treat many of the conditions that killed or damaged their patients. But perhaps most importantly, the stone baby represents Caroline Webb's suffering and her loss. The loss of the child she conceived, but who never had a chance to live. The loss of the 3 years she spent carrying death without knowing it. The loss of her mental health and ultimately her life as a result of trauma that destroyed her psychologically in ways that no one in her community had the knowledge or resources to address. Her story reminds us that behind every medical case report, every preserved specimen, every unusual condition documented in medical literature, there are human beings whose lives are affected in profound and lasting ways by what happens to their bodies. What do you think about Caroline Webb's case? Could modern medicine have prevented the 3 years she spent carrying the stone baby? What would it be like to give birth to something that had died years earlier? How should medical science balance the need to study rare conditions with respect for patients' privacy and dignity? Leave your thoughts in the comments below. If you found this investigation compelling, subscribe to Shadows of America. We release documentaries like this every day at 9 a.m. and 6 p.m. EST. Hit that like button, share this video, and let us know what state you're watching from. The past is never truly buried. It's just waiting in the shadows.